out there, and we really want to work with as many as we can.
However, we have to make sure that the insurance company has a PPO network attached to it so that the patient does not have to go to somebody who participates with that plan. They're free to go to somebody outside of the plan.
Right, Amy, if it's not a PPO, they have to go to who their insurance company tells them they have to go to.
That's correct. In order to get the insurance benefit, they have to go in network.
Now that we know the patient's allowed to come to this office, let's kind of tell them how it's broken down, what type of categories there are, and how that works with the percentages and how it's covered.
Okay, so there's 3 categories. There's preventative, which is covered at 100%, basic, which is generally covered at 80%, and major, 50%. The percentages may change with the different insurance companies, but preventative covers cleanings, checkups, x-rays, fluoride, sealants, any maintenance would be covered 100%, and we would accept whatever your insurance company would pay for that.
Right, and typically that's every 6 months or 2 times a year.
Correct. Then the next category is basic, which is generally resins, cavities, fillings.
Right. General. Yes, major is major. It's major work inside your mouth as well as major right out of your pocketbook, a big expense. So we try to prevent that with the word preventative care, 100% coverage. We want you to come in. We want to avoid these potential major problems. So that's why we send out our cards. We call you. Please come for your checkups. Wait, Amy. Explain a little bit about the deductible.
The deductible is an amount that gets deducted from the payment for certain procedures. It generally does not come out of preventative, it comes out of major and basic. So the patient has to pay that deductible up front before the procedure is complete.
And typically, from what we see, it's $25, $50, or $75.
That's correct.
Another very important topic about dental insurance is the maximum that the insurance will pay for the year. And there is a limit, and it's different depending on your policy.
Right. Each insurance company sets their own limit, and you have that per year. Sometimes you're on a calendar year, sometimes it could be on a fiscal year. An example of a fiscal year would be August 1st through July 31st. So that is something else that we check for our patients when we find out about their information.
So that maximum becomes available again on August 1st or January 1st, depending on it. And that is the limit that the insurance company will pay, and it could be used up very quickly depending on what needs to be done. And we talked about major, so it will definitely use up that maximum quicker. So again, that's why we push the importance of preventative with 100% so that we can avoid that. We've been talking a lot about general dentistry, family dentistry. That's for everybody, all ages. But what's becoming part of routine now is cosmetic dentistry. So that's becoming more and more popular, and it's becoming part of general dentistry now.